Well, hello, everybody, and thank you so much for tuning in to what should be a great discussion and conversation about mental health. More specifically, how to start a conversation about mental health and how to support someone who confides in you that they are dealing with stress and anxiety. My name is Dan Murphy, and I'll be your moderator today. I'm a broadcaster with Rogers Sportsnet. My main duties are hosting Canucks broadcasts, but you may also see me on Hockey Night in Canada and calling Rogers Cup tennis. Okay, what are we? 15, 16 months into this pandemic, COVID-19 has taken a significant toll on the mental health and well-being of Canadian men and their families. No doubt. It's been an incredibly difficult time for those who previously didn't even suffer from anxiety or stress. So just imagine how tough it's been for those dealing with mental health issues before the pandemic even began. The time to take our mental health seriously starts now. And we're doing this through the Canadian Men's Health Foundation and our partner, Anxiety Canada. And they are committed to improving the resources available to men struggling with their mental health. How? Well, move for your mental health in a time of uncertainty. Learn something new about coping with stress, anxiety, and loneliness. Inspire others, which we hope to do today with helpful tools and strategies, and fundraise for mental health programs to help more men live healthier. And before we get going, we should say thank you to our partner, Anxiety Canada, and sponsor Ventana Construction for making today's event possible. Now, it's not just me today. We have to have experts in the field. So very pleased to be joined by a couple of, just should be great speakers on this topic. We're joined by retired National Hockey League player and current Hockey Night in Canada analyst, Kevin Bieksa. Of course, a longtime Vancouver Canuck, part of the Blue Line during the most successful years of the franchise. And also joined by Dr. Melanie Badali, registered psychologist, certified in the practice of cognitive behavior therapy. Dr. Badali serves on the board of directors for Anxiety Canada. I'll be sharing some expert advice throughout our chat today. So welcome you two. And we're going to start quickly with Kevin, who obviously is not a doctor, but Kevin, you've been involved in mental health awareness for some time because of a friendship you had with a young man by the name of Rick Rippon. So perhaps just share your story there.
Well, thanks for the intro, Dan. Is it that obvious that I'm not a doctor? I could go back a pair of my glasses too and look a little bit more intelligent. But you're right. I'm not an expert, and that's one thing that I always make clear when I speak about mental health and mental illness is I'm not a doctor. I'm just a layman, for lack of a better term, that dealt with something with a good friend, Rick Rippon, 10 years ago this August. It's been 10 years. Where Rick lost his life and lost his battle with depression and anxiety. And I happened to be the first person that he reached out to, I think 3 years prior, in a car ride from downtown Vancouver out to Burnaby 8 rinks. It was a drive that it was a preseason practice. And we just came off of our first year in the National Hockey League together, young 20-year-olds. Living the dream, finally accomplished our goal in life that we've been training for our whole life. And when he kind of said to me, I almost didn't come back this year, my mind was blown. And I thought right away, how could you possibly feel that way? Like we finally accomplished what we've been training for our whole lives. We're, for lack of a better term, we're gods in our hometowns because we're the kids from minor hockey that actually made it. And why would you feel this way? So I didn't quite understand how he was feeling. And it was a learning lesson for me because I didn't have to understand how he was feeling. All I had to do was basically be an ear and a support system for him and let him vent and let him express himself. And we could be here all day if I talked about the ins and outs of it, but he ended up coming to live with me and my wife and I opened up our house and we did whatever we could to help support him. And it was a struggle. And it was, I inherited a responsibility when he reached out and confided in me first. And that's something that I took until the day he left us. And at times I feel like probably could have done a better job, but I just didn't have the education. Luckily, we have Dr. Badali here today that can kind of clarify some of the things I did right or did wrong. But Rick was a good friend and we lost him 10 years ago this August and still miss him, still think about him every day.
Kevin, we'll get more into how those conversations started and how you supported him. But Dr. Badali, you see a young man who is a National Hockey League player, who has not been afraid of anything in his life. And you always hear, especially in sports and athletes, suck it up, don't cry. But really, I think studies are showing that more men are dealing with stress and anxiety than ever. And it's sometimes difficult for those men to speak up, isn't it?
Absolutely. And I think it is probably a sign of our culture changing, that we are seeing more men be able to speak up. I don't think it's necessarily been a gender imbalance due to men not dealing with anxiety and depression and stress and all these mental health problems, and indeed more serious illnesses. So definitely, good to see more people feeling that they can speak out, but there's still so much stigma, and we have a long way to go.
Kevin, you mentioned that the ride to 8 rinks. That was the first time that Rick opened up with you. Did you know he'd had any history of mental health? Had there been any signs in your mind?
No, there wasn't, Dan. And I spent a lot of time with him. And when he came and he joined the team in the AHL season, I got to know him pretty quick, but there still was always like a side to him that I thought he was hiding from us. But again, I'm no expert. What do I know, right? So we were close friends, but at times I could kind of see, some of the internal struggles that he was going through himself. And again, to Dr. Badali's point, the stigma around mental illness was a lot different. And I know we've come a long way and there's still a long way to go, but think about it 13 years ago. If you're a male playing professional sports and you're an alpha male, you're a guy, like you said, Dan, who didn't back down for anyone. He wasn't a big guy. He was the toughest pound for pound player that I ever played with. And his dad was a Gold Gloves boxer. His brother was a UFC fighter. This is a tough family. You do not admit 13 years ago that you are having anxiety or depression in an alpha family like that. So I imagine it was very difficult for him to confide in me, who's another alpha male and is another tough guy. We're top of the food chain here. We're in the NHL. We're tough guys. And sometimes it's very difficult for tough guys to admit that they're struggling with something, especially a mental illness, because back then that was considered being mentally weak. That was a detriment to your career. If people thought you were mentally weak, and that term was used all the time, you were quickly shunned aside, and coaches would find out and GMs would find out. So there was this, this feeling that you had to hide this, you had to shelter this from everybody. But when he confided in me, that was a huge step, because maybe we did help preserve his life a few more years, ultimately lost the battle, but he was struggling. For him to kind of reach out to me, you have to think, what was he really battling inside? He must have really been battling that he felt like he had to say something to me.
Had he confided in anyone else? I mean, I know that he had spoken with the GM of the Moose. Do you know if he'd sought professional help at that time, Kevin?
Not at that time. I know he reached out to Craig Heisinger, you mentioned, who's now the assistant GM of the Winnipeg Jets. He was the general manager of the Manitoba Moose, the team that we played for in the AHL that we met. And Zinger, we call him. Zinger and Rip had a really close relationship as well. And Rick confided into him. So as far as I knew, only Zinger and myself knew. So Zinger and I had, looped each other in, and it was kind of like the three of us working this triangle to help support him. And ultimately, we pushed him towards the NHL substance abuse and behavioral program with Dr. Shaw and Dr. Lewis. And Dr. Shaw did a great job, and they helped get him some help. And he was in the program and out of the program twice. I mean, I kind of debriefed him when he got out the first time, and I said, what was it like? How did it work? And it's like anything, it's what you put in. So I think with those programs, if you really want help or you really can be helped, it happens for you. But I think if you want to just get in and get out, you can tell people the right things and tell them what they want to hear. So ultimately, the program wasn't successful for Rip because his goal was to get in and out and get back into the National Hockey League. He wanted a quick fix. He wanted a Band-Aid. He didn't want to draw any attention to himself. So when he got out after the second time, he, after trying to deal with this internally, he just couldn't handle it. And he ended up taking a leave of absence from the team. And he went back to his house, which is in the middle of the beautiful mountains in Alberta, but it's very isolated and secluded. And he was by himself there for a month. And Craig Heisinger and I, at some point, were talking and we said, we got to go get him. This is just not good for him to be alone and isolated, because that's the one thing he always complained about. He hated being alone. He loved being at the rink. He loved being in the dressing room. When he was in the room, he was joking around with the guys. He looked fine, like he was coping. But when he went home and he was by himself, he said that was his darkest times. So we just tried to keep him around the guys as much as possible. And that's when we went and I brought him back, and he lived with my wife and I. We just had our son. My wife was pregnant, and he lived with us for a while. And there were days at a time that he would not come out of his room, and he would just shelter himself in his room and going through all the things in his head. And then when he would come out of his room, we'd sit at the kitchen table and we'd talk for 5, 6, 7 hours. And it was recurring topics and recurring themes. And we were basically just letting him just express himself and just trying to be an ear for him. And didn't have any answers for him, but at least we were just listening and just letting him talk and express himself.
Dr. Bedolli, we'll get to maybe the signs if you think someone's dealing with it, but what if someone does come out to you and says, this is what I'm dealing with, I'm struggling? If someone confides in you, how should you handle that?
I think that's a very important question. And I think it's important to also say there is no like magic bullet, right? I think sometimes we have to try something and then we might have to try something else. I'm a fan of open-ended questions like, how can I help? Right? Because sometimes what somebody wants from you is that social support. They want somebody that they can joke around with and feel alive for a minute. Like Kevin mentioned, sometimes when people are in the locker room, they actually are feeling better in that moment, right? Sometimes people want practical support. Can you help me navigate the healthcare system? Sometimes they want informational support. Do you know of somebody who's been through this? Do you know of a good source of information? Like Anxiety Canada, where I can get some science-based tips and tools of how to deal with this. And so I think, approaching this from the point of view of the person, really just asking them, how can I help? Being a safe person for them, and then taking whatever they say and kind of running with that.
And what if they confide in you once and then don't really circle back around to it in a day or 2 days or a week? I mean, as Kevin said, Rick would go into a room for days at a time. And obviously they knew he was still struggling, but it was kind of on his terms to come out and talk more about it. What if someone kind of retreats in that fashion?
I would check in with them. Right. Again, it depends on what type of relationship you have with the person, whether you're going to be showing up at their door or you're going to be sending a text. I would definitely check in.
So what we did, Dr. Bedolli, is when he would stay in his room for days at a time, he obviously had to eat. So we would leave a tray of food outside his door, and then we'd come back. Sometimes it'd be gone, and sometimes it was still sitting there intact 2 hours later. So we would send my son, who was a 2-year-old, who just, he would walk and carry the tray, and he'd knock on the door, and Rick would always open the door for my son. So at least we'd get him to open the door by sending my son there. Just like you said, using any tactic that we could to just check on him, to make sure, like I wanted to physically see him to make sure he was okay. Right. And help. But if they don't let you help, you're kind of struggling. So we would use little tricks like that just to get a little glimpse of him and check on. My wife and I would hang around the corner, and we peek around the corner just to see if we could see his face. And you give my son that little smile, and we knew, okay, like things are okay for today.
Okay for today. And I think that could be a slogan for something, because when you're really in it, sometimes it's okay for the next 10 minutes. It really is one of those things. Symptoms do wax and wane. You never really know what's behind that door. I think that treatments fail people. People don't fail treatments and programs, and targeting services to where a person's at can be really difficult if they're not transparent with where they're really at. And again, this is one of those things. One supportive friend is seldom enough, right? We need cultural changes. We need access to services that are a good fit. It is a very, very challenging situation. And it sounds like your friend was really lucky to have the support of you and your family.
Kevin, what led to Rick living with you? Did you suggest it? Did he suggest coming to live with you?
No, he didn't suggest it. What happened was, Murph, when he was gone for the month, I would still check in with, I think it was about a month. I would check in with him every day via text, and sometimes he would text me, sometimes he wouldn't. And as the stay got extended, he would go a day or two in between texting me. I would reach out to Zinger. Zinger, same thing. I go, when's the last time you talked to Rick? It's been 2 days, 3 days. So that got a little bit more extended to the point where we talked and we said, listen, it's probably not good for him to be out there on his own. He had some family close by, but when we reached out to his grandmother was a nurse, and we would talk with her a lot, and she would say the same thing. Haven't heard from him for 3-4 days. So that worried us. So we made a plan that we were going to be in Edmonton, and Zinger and I, after the Edmonton game, we're going to fly or drive out to his hometown and basically just show up there and convince him to come back to Vancouver. And the only way that, we could really keep an eye on staying at my house. So I can't remember whose idea it was, but Zinger and I basically decided on the way. So it was a snowstorm. We played Edmonton and Edmonton. The team continued on to a flight afterwards. Zinger and I believe we flew into Lethbridge, and then we rented a car and we drove through a snowstorm. It was a whiteout. And we got to his hometown and we said, okay, what's the plan here when we get to his house? We can't just show up and say, come back with us. Like, what if he says no? And I said, well, listen, he's a really tough guy, but there's 2 of us. So what's going to happen is you're going to distract him and talk to him. I'm going to sneak up behind him. I'm going to rear naked choke him, not like put him out, but I'm just going to subdue him. Then we're going to drag him into the car. I'll sit on him. And then when we get far enough away from his house, we'll talk some sense into him. So joking around a little bit, but our plan was we're just not going to take no for an answer. So luckily, he didn't really fight us that much. He came back, and then he, like I said, he moved in with us, and at least we could kind of keep an eye on him. And we told him, listen, you don't have to come back to the rink if you don't want. You don't have to play. This is not about hockey. This is about you as a person getting healthy. So I think after staying with me for a few weeks, he wanted to start coming to the rink. And again, there was some apprehension by him because nobody really knew his situation, and he asked that I keep it private, which I did. I respected his wishes, but the general manager, Mike Gillis, knew, and I'm sure the coaching staff knew. So Rick would always ask me, is anyone asking about me? What are the Twins saying? What's Burrows saying? What's Kess saying? I go, I'm just telling them all, listen, he's going through some issues right now. Respect his privacy. And I remember guys getting mad at me, not the Twins, but Kess and Burr saying, just tell us. Why aren't you going to tell us? Just tell us what's going on with Rick. What's the matter? And I'm like, I want to, but it's not my place to say. Just respect his privacy. So eventually Rick felt comfortable that I could tell them a little bit what was happening. And then he started coming around the rink again. And again, that was his safe haven. That's where he felt comfortable being around the guys and being around people. And he was happy in those moments.
So Dr. Badali, what advice can you give to people who may be living with someone that's dealing with mental health issues?
Well, I think my first piece of advice is you might need some support too. And listening to, Kevin talk, I think really illustrates that point. It can be really difficult to, watch someone you care about suffering. And it can be hard to be trying to get them help. And whether it's you're running into a wall in terms of being able to access that help, or the person, that you're trying to help is just not quite ready for more intensive treatment, which is, what someone who is suffering like that probably needs. It's very difficult. And so that would be one piece of advice. I think, educating yourself, reaching out, creating as much of a kind of a village of support as you can for both the person and yourself.
Kevin, did you find it difficult being kind of the point man, for lack of a better term, yourself and Heisinger? Was it, you find it being a burden? Did you reach out to more people for help on how you could approach Rick?
No, I wouldn't say I felt it was a burden, Murph. I felt, I didn't really think about it, honestly, from my point of view. I wasn't thinking about it. How do I feel about this? Is this I just felt I just wanted to help him. And, you know, like I like everything I set out to do, I want to accomplish it. And I just didn't know how to help him. And I was trying to, and, you know, I reached out to a lot of people. Luckily, my wife, Katie, has suffered through mental illness her whole life. And she was huge. And she actually probably did more of the talking with Rick than I did. Sometimes I'd have to go to bed because I had a game the next day. So I'd have to go to bed by 12 or 1. And Rick still was at one of those days, he was out of his room and he was at dinner and he was talking, and my wife would stay up with him till 5 a.m. and I would go to bed with my son, and they would sit there and they would talk because they had a common bond that way. And my wife has used medication for the last 10 years and she's been unbelievable. And she really swears by it, but she also says everyone's different. Some people medication works, and, you know, there's other techniques you can use if you don't want to use medication, but she's found that balance. And we were basically just trying to find the balance for Rick.
Dr. Badali, what about in those times where the person is ready to open up, or they're having a day where they want to talk? How do you go about listening in the best way?
Well, I think you said the key word, which is listening. And one of the tricks of professional counselors and psychologists is something called reflective listening. And so that is listening to the person and then saying something back. So if they say, you know, I just don't think I'm up to the challenge of, you know, an inpatient stay, people are going to think I'm crazy. Who else is going to be there? I'll never be able to be a professional hockey player again. Or if I am, everybody's going to look at me funny, you know, kind of whatever it is. You don't have to do some, you know, convince them it's going to be something different. You can just say back, it sounds like you're really concerned about, you know, what other people are going to think of you, or, you know, whatever they've said back. And that usually keeps the conversation going, right? When we try and jump in too fast to fix something or change something, it can shut people down. So I think, you know, starting with that listening, but really reflective listening. Don't try and do that one up type of listening, which is, I had this time, you know, and I felt even worse, right? I think there's that balance. Of course, it can be incredibly inspiring and helpful and hopeful to have someone say, I went through a period and I'm on medication, and I think they should be putting this stuff in the water for people because it's been so helpful for me. I don't think there should be any stigma against mental health problems. Mental illness is just like any type of health problem. Like, it's not that you can't ever talk about yourself or say things, but I think if you want to kind of keep the conversation going a bit longer, really focus on them and reflect back.
How can you ask the difficult questions? Like, if you really think they're struggling, you know, more than just are you okay? Like, are you going to be okay? Like, you want them to talk, but what if you're worried? How do you approach those questions?
Great question. I think we really want to set the stage for safety. You want to be that safe person, create that environment. I wouldn't have a lot of distractions happening. You want to pick your timing. In terms of asking, in addition to asking open-ended questions, which people recommend for these types of situations, I think you might need to ask more than once. So how are you doing? How are you really doing? Like, okay, that's the front stage answer, or that's the on ice answer. What's the locker room answer? Or what's the car ride to the rink answer, which is probably different than the locker room answer. Like, really, you know, you don't want to invalidate someone's experience, and you do want to respect their privacy and dignity, but maybe just that extra gentle probe, like, really, because it's really stressful right now. And this, you know, this is a tough environment.
Murph, if I could add to that, Dr. Badali said, like, now when we're dealing with mental illness, now is a lot different than 10 minutes from now. And there was one time when Rick was staying with me and I had to leave town and I went on a road trip. And while I was gone, Rick was pulled over by the police. They thought he was driving and intoxicated. They ended up bringing him to the hospital. And it turns out they did a breathalyzer. He had no alcohol in him at all. Turns out he took too many antidepressant pills, the pills that were prescribed to him. He took too many of them and he was loopy. So they saw him swerving. They pulled him over. They brought him to the hospital. I believe they pumped his stomach. When I got home and I went to the hospital, because he was admitted there, I can't remember the hospital downtown. You probably know what I'm talking about. The one on Burrard there.
St. Paul's.
I went there and I remember when the doctors and the nurses walked away and I'm sitting there with them and I said to him, I go, Rick, I go, you would never actually hurt yourself? Would you ever, like, do you feel like you're at the point where you would actually take your own life? Like I point blank asked them that because I wanted to know, like, where are we at here? Like, should I be watching you even more carefully? Like, should I take a leave of absence from the team and just be your chaperone 24 hours and just be your ear to listen to and just gauge your moods and how you're feeling and when you're dangerous to yourself? And he looked at me and he goes, no, like, he goes, I made a mistake. I took too many of the pills. I mixed up the dosage, and he convinced me. And maybe in that point, in that time, maybe he really believed that, but obviously he had a change of heart at some point because he ended up hurting himself. So to your point, Dr. Badali, you have to keep checking up. Like, you can't just ask once, you can't just ask twice. I think 10 minutes from now is a lot different. A lot of things go on in 10 minutes.
Yeah. And I also think that you can check, and sometimes when people are at their most vulnerable, they won't reveal what's going on. I still have some moments from my career where I experienced chills when I did a check-in and someone said, if I'm going to do it, I'm not going to tell you. You're never going to know. And then, what do you do with that? What do you do with, I'm a professional, and I still have that moment. Right. And this is why this is so difficult. It's not like you get some purple warning spots where you can be watching someone and, say, oh, there it is. There's the sign, right? That objective evidence that we're in danger territory. It's basically symptoms at this point in time. Maybe, another 10 years, we'll see some great neuroscience. You'll have a stressoscope or something that we can measure this stuff. But right now, we are often relying on what a person is up to sharing. And sometimes when they're at their most vulnerable, they really truly believe that they are a burden. Use the word burden, Kevin. A lot of people really do feel like they're burdened, and they think, I don't want you to leave the NHL, or I don't want you to take time away from your kid. Not everybody's famous and people have to deal with this. I don't want to have help, right? And in that moment, they think that's going to be good for other people, the people that they loved ones. And I can't even tell you how many times I've had conversations with people where I can say, I guarantee it's not easier for them if you're gone.
So what if someone doesn't want to confide and they don't want to be, as you said, the burden? They don't want to have to rely on someone. What resources are available to someone who might be looking internally or online to get help themselves before they may ask someone?
I think that's a great question. So here in Canada, you can go to the website crisisservices.ca, and they have, the different confidential 24-hour crisis lines you can call, resources. You can also call if you're the support person, if you're the friend, if you're the concerned person, to talk through what are the steps. Do I need to call 911 on the person? Unfortunately, right now, our system, not just in Canada, but in the US, is really struggling with what happens. We need a better system for having people go when it's a mental health call, right? Right now, some places it's the police that go. Sometimes there's a trained mental health professional. It's really it's a really challenging situation. And so I do think that, kind of reaching out here in BC, that the number is 1-800-SUICIDE, and the numbers go along with it. But crisisservices.ca, chat services, telephone services, and always there's 911, right? Sometimes it really is an emergency, and the answer is 911, and go to your nearest emergency room. And this is not being a burden. This is not taking away from other healthcare resources. That's what we have for mental health for crisis right now. And that's, you can use that.
Kevin, when Rick would confide in you and you probably wanted to seek some advice from others, did you feel like you're going behind his back, or was this just something that you had to do to make sure that he was going to be okay?
Well, yeah, I was definitely doing some digging behind his back that he didn't know about, just to educate myself and, again, figure out if was I handling this the right way. And luckily I had my wife also doing the same thing from her end. And I had to be careful though, Dan, because I really felt like I couldn't betray his trust. And if I was the guy and Zinger, we were the two guys that he trusted, how would he feel, or where would he be if he felt like we betrayed him? So it was a slippery slope. I had to really make sure that I navigated it the right way. And he knew that I had his back first and foremost. And that's when I go back to talking about when he would say, what do the guys on the team think? What do they think? Like, I just don't want to be a burden. Like, that burden word was used a lot. I don't want to be a burden. I don't want everyone to be talking about me on the team. I don't want them to be thinking about me. Like, just tell them, like, just make something up. And I had to always keep his trust and make sure he knew that, you know, whatever I was saying or doing, I was in his corner, and I was, you know, I had his back.
When do you think he finally got comfortable opening up to others, Kevin?
I think it was after he kind of left the team, and he was in the program twice, and he ended up taking a leave of absence. I felt like, and this was during the 2011 Stanley Cup run that we went on, and it was kind of sad in the sense that he was part of that core of that team, and he didn't even get to participate in the golden year or the golden run that we had. And I know he was at home watching, and I'm sure that didn't feel good for him. But in that summer after the 2011 run we made, he signed with the Winnipeg Jets, and where Craig Heisinger was now the assistant GM, and he was going to go back there in a place where they knew his history. And I felt good about that. And I think he did, because I think he was going back to a place where he wanted. And I think he really, and I should add, TC Carling is another name that was in the loop, and TC worked for the Canucks at the time, and TC Carling was probably the main person who helped start Hockey Talks, which is an NHL backed initiative now, where I think there's 18 teams that participate. Well, it started with just one, the Vancouver Canucks, and that was to carry on Rick's legacy. And TC helped coordinate some youth summits and that I spoke at a few times, and he's done a lot of great work. I believe he's the president now of CMHF. And there was a few more people that knew about his situation once Rick got comfortable, but that took years, Dan, to answer your question. That took years. And then he started to say things like to me and TC that he wanted to go around and start speaking to schools and talking to kids and share his experience and how he feels and help them deal with it. Because how many other kids were just sitting there suffering in silence and didn't feel comfortable reaching out. You'd be surprised, like, still to this day, how many people reach out to me on Twitter, a private message, or Instagram. Like, literally a day ago, a girl reaches out to me privately and says, "You've never met me. I'm struggling. I'm suffering internally. I can't tell my boyfriend. I can't tell my parents. I just don't know where to go, what to do." And to Dr. Badali's point, where do we send them? Like, where do we send? Like, yeah, maybe she's not suicidal at this point, but so you can't call 1-800-SUICIDE. Can't call the police, because what are you going to say? Like, you know, they're going to say, well, go talk to your parents, go talk to your boyfriend. So, like, we don't really have a clear path yet, I think. And as much as Rick's death, I really think triggered a huge culture shift, especially in pro sports. And there's so many people that are comfortable talking about their struggles now. Like, that's a good thing. Like Robin Leonard is the goalie for the Golden Knights, who's openly talked about at the NHL awards struggling with mental illness. He's talked about it in interviews. Like, that's awesome. That's great, because we're destigmatizing it, but we still don't know how to treat it exactly and where to go. And that's probably like more of a budget conversation. Like, we need to talk about the budget and how we allocate our money to mental health resources in BC, especially. But that's a big question. Like, we have people that are suffering now. We're getting to a point where they're comfortable telling people, but now where do we send them? Like, what's the proper channel to get them help?
Dr. Badal, I'll let you answer that too. And Tyler Mott's another player with the Canucks that's spoken out about his mental health issues too. But you talked about when it got to a crisis, Dr. Badal. What about before that? What if people are just starting to feel stress, starting to feel anxiety, and you're not at that tipping point?
I think that's a great question. You know, here in Canada, your family physician or your GP is a good starting point. You know, 20 to 40% of visits to GPs are for mental health reasons. And there's still a lot of people who don't think that they're allowed to talk about mental health at all, but also they forget that mental health is part of health. It's not something different, right? And if you see, like, even if we just, you know, talk about professional athletes, how many have had concussions? How many maybe have had to take pain medication or an injury or something like that? Like, it's a complicated situation, and there's all sorts of variables that, you know, go into it. So that's usually a pretty decent starting point. I think you should think about mental health like we think about dental health, right? There's the routine checkups. And then sometimes, you know, you need cavities filled, and then sometimes you need surgery. And of course, there are things that you can do on a daily basis to promote your health and prevent things like, you know, brushing your teeth and flossing. There's the, you know, self-care equivalent for mental health of those things. And so, you know, one of the reasons that I volunteer for the nonprofit organization Anxiety Canada is for those people who are experiencing mild and moderate anxiety, mild to moderate anxiety. So at the kind of at the beginning of things, it's a place where they can go to get reputable information, because we all know the internet can be a rabbit hole of misinformation and doom and gloom. At least with Anxiety Canada, you get science-based information. There's, okay, oh yeah, that sort of sounds like me. What are some things that I can do to manage anxiety, to, you know, make it better? So there's a lot of those types of resources out there that can help you improve your health literacy. But I agree with Kevin. I think we've done a lot of talking about busting up stigma and let's talk, and we need easy pathways for people, and not just ones that are accessible, but ones that are acceptable. Like sometimes the options are not acceptable to people. They're not culturally appropriate. Or you have to pay for them, things like that. So we still have a lot of work to do.
I'll follow that one up with, you know, a lot of people that might be watching right now during the course of the pandemic have had those moments where they wake up and it's the blahs. It's, I'm worried about money. I'm not sleeping. You know, I don't know if I can do another day in the house. I'm still homeschooling, whatever. I know that this is a move for Mental Health Month. Are there simple things you can do, like just make sure you get outside and make sure you go for a walk?
Yes, and those things are good, again, for health promotion and prevention. They're not going to cure an anxiety disorder or depression. That said, even things like exercise with a big regular dose, there's actually some good research showing exercise can help with depression. It can help with anxiety. It can help lower stress levels. Even one session of exercise can make you feel better in the moment. So that's important. I think when we're thinking about self-care, think about it like this. Take care of yourself like you take care of someone you love. Okay, so healthy food in your body, get it moving, get exercise, healthy thoughts. Don't talk to yourself like you're an idiot, right? Like you want to be nice to yourself. You want to be kind to yourself. You want to reality check thoughts. You want to engage in healthy behaviors, and you want support. Right? That's part of self-care too, is reaching out and getting support that is available. And if it's not available, recognizing, hey, this is a pandemic, or this is a culture that doesn't recognize you can be strong and vulnerable at the same time. And don't take that all on. Don't say, this is me, I'm a burden. You know, you need to be able to kind of, instead of using that negative mental filter, sort of do the wide angle lens and say, oh, this is complicated, and there's social determinants of health, and there's biological determinants of health, and then there are the things I can do. And then you grab onto the things that you can do.
We'll start wrapping things up here, but Kevin, I want to ask you, why will you never stop talking about Rick?
Well, it was Rick's wish, and I think we have to build something positive out of something that was a terrible thing. And the positive thing is, like I said, it triggered this movement in the NHL and hopefully in professional sports, where people started continue to start openly talking about their mental struggles, because everybody has them to some degree. Some are worse than others, but there's a lot of people that still feel like it's a sign of weakness, and it isn't a sign of weakness. It's something that if we talk about it and we talk about it openly, and there's no stigma, and we all realize that everyone has different degrees of it, then it's a lot easier to get help. But if we're hiding things and we're sharing and we're not sharing with, you know, our loved ones, you know, there's no way to actually get help for this disease. And I don't want to see any more young men in the NHL at the top of their game, you know, career-wise, you know, take their own lives. Like, that just can't happen with the resources we have and the platform we have. And I'm proud to say that, you know, Rick's death has promoted a lot of change with the Hockey Talks initiative. And, mindcheck.ca, we relaunched that website. That was a huge success. That's turned into foundrybc.ca. I did some work with the LAPD down here where I filmed a video talking about Rick's situation. And before I even knew it, they were using that in their training week for their officers, their 1 week training week of mental health. They were actually using my video. And a gentleman that was down there was observing, found out, and we remade the video and updated it. So that's continuing to help out LAPD officers. And there's just so much more work to do. Bell Let's Talk. Michael Landsberg has helped spearhead that. He's a great online, grader, maybe a little bit better than you, Murph, a little bit more experience than you, but he's using his platform for a good thing. And he openly suffers and openly talks about it. So there's a lot of people working to make change, and it's great because there's been a big change in 10 years, only 10 years. And look at where we come. I can't imagine. I'm excited to see where we are in 10 more years.
Dr. Bedell, how much can this help to see people like Kevin, helping bring these issues to the forefront?
The impact is huge. Professional hockey players are role models and people look up to them. And it's very important. And I've seen the ripple effects, even in my practice, someone, maybe saw Kevin speak or read an article by Corey Hirsch, and they that's why they came for therapy. They thought, oh, I didn't know that I was allowed to. And of course you're allowed to, but there's sometimes, even before we can get to whatever the issue is, I have to peel back layers of shame, this sense that you're bad. And, we don't have to deal with that with other types of health problems. And I don't want to deal with that for mental health problems either. And so having people talk about this openly and be able to say, hey, do you know a good therapist? In the same way as you'd say, do you know who cuts your hair? Or do you have a good dentist? That's where I want us to be. And we're on our way.
Okay, well, I think that this is probably a good time to wrap it up. I want to thank you guys so much. Dr. Bedell, this is our second time doing one of these, and information is always excellent. And Kevin, it's always fun to talk and to see your face, no matter how much fun you make of me. I still enjoy our chat. So good to talk with you. I want to say just a couple of things here. We need to again thank our sponsor, Ventana Construction. A shout out to the people at Anxiety Canada as well. If you like what you heard, please share and like this video. menshealthfoundation.ca for more resources. Please check it out if you want to find some things out on the topic. And should say, don't miss the next event, June 9th. Longtime NHL player and executive Trevor Linden, four-time Olympian Simon Whitfield, and Anxiety Canada expert psychologist Dr. Gordon Esmunson on the topic of how daily movement and exercise can improve your mental health. And don't forget, as national charities, the Canadian Men's Health Foundation and Anxiety Canada rely on donations to create relatable and engaging resources for Canadians. Every dollar raised from this event will fund mental health programming and services online to support Canadian men and their families. So we've included a donation link in the description of this post. So please donate if you can. Every dollar helps. So again, thanks so much for tuning in. Kevin, Dr. Bedell, we appreciate your input, and we look forward to chatting with everyone down the road. Take care.